Today, more than ever before, people like you are taking an active part in decisions concerning their health care. To make your decision, you want to understand your health condition and the options available for diagnosis and treatment. In this program, I will present important facts about the procedure that has been recommended for you, cardiac catheterization. I will explain in detail what you could expect concerning this procedure. To be informed about cardiac catheterization, you need to understand your medical problem, the recommended procedure to diagnose or treat your problem, the risks involved, the alternatives to the procedure, and the effectiveness of the procedure. Chest pain is a common medical problem. It affects different people at different times in various situations. Chest pain may occur when there is an inadequate supply of blood to the heart. Chest pain may occur at times when you exert yourself, are emotionally upset, after eating too much, or after being exposed to extreme cold. These instances are referred to as the 4 E's. Chest pain commonly occurs when the heart is not receiving enough blood. The heart is supplied by blood vessels known as coronary arteries. The coronary arteries are located on the surface of the heart. They are approximately 1/8 inch in diameter. Their only function is to supply blood to the heart. In coronary artery disease, or CAD, these arteries become narrowed by a buildup of fatty deposits. These deposits, which are mostly made up of cholesterol, decrease the amounts of blood flowing to the heart. If these deposits prevent the heart from receiving enough blood to satisfy its needs, chest pain may result. A cardiologist may perform cardiac catheterization to determine which of your coronary arteries may be narrowed, which parts of them may be narrowed, and how much they may be narrowed. Cardiac catheterization is a procedure in which a cardiologist will insert a long, thin, flexible tube called a catheter into a blood vessel in either leg or arm, depending on the cardiologist. Your cardiologist will follow the movement of the catheter to your heart with an X-ray machine known as a fluoroscope. The movement of the catheter will appear on a television screen to permit him to follow it to your heart. When the catheter reaches your heart, dye will be injected into each of your coronary arteries through the catheter. Moving X-ray pictures will be taken that show the dye flowing through your coronary arteries. These X-rays will allow your cardiologist to see if your coronary arteries are narrowed, blocked, or normal. Before undergoing cardiac catheterization, you should tell your doctor if you're allergic to iodine or any drugs or food, and if you're presently taking any medication. If you are, or suspect you might be pregnant, be sure to tell your doctor. X-rays taken during catheterization could be harmful to your unborn child. The night before your catheterization, your groin area or arm may be shaved. If your cardiologist has scheduled your procedure for the morning, you will not be allowed to eat past midnight. If you're scheduled for the afternoon, you may be given a small liquid breakfast. About half an hour before the cardiac catheterization, your nurse may give you a mild tranquilizer for relaxation. It might also make you feel sleepy. You will be encouraged to urinate before leaving your room. You will then be taken to the cardiac catheterization lab, where your cardiologist and nurses will be waiting for you. This lab contains all the medical safety features of an operating room. Electrocardiogram leads will be placed on your arms, legs, and chest. The other end of these leads will be connected to a machine that will record your heartbeat on a graph. The shaved area in the middle of your arm or groin, where the catheter will be inserted, will be washed with an antiseptic solution to prevent infection. This same location will then be numbed by injecting a local anesthetic. Through this prepared area, your cardiologist will pass the catheter. The catheter is about the diameter of a thin straw. One end of the catheter will be placed in a blood vessel. The other end of the catheter may be attached to instruments which monitor your blood pressure and heartbeat. Using a special X-ray machine called a fluoroscope, your cardiologist will watch the movement of the catheter as it is advanced through your blood vessels up to your heart. The catheter tip will then enter the heart itself. Once the catheter is in position, blood samples can be taken to be analyzed for their oxygen content. To film your heart structure, a dye-like substance will be injected through the catheter into your heart. Injections may be made into the coronary arteries and also into the heart chamber. During the time the dye is injected, you may feel a warm flush. This feeling will last for 20 to 30 seconds. The dye that is injected into your heart can be seen on the fluoroscope screen. One of the most common tests performed with cardiac catheterization is coronary arteriography. In this procedure, a catheter is moved into each coronary artery. Dye is then injected directly into each blood vessel. The dye, mixed with the blood, outlines the coronary arteries in white. Any blockages or narrowing in these coronary arteries will show up as dark areas within the coronary arteries that are outlined in white. Your cardiologist will take movies of these X-rays. After the procedure, he can study them carefully to determine which, if any, of your coronary arteries may be narrowed. Also, the size, shape, and motion of the heart chambers can be visualized by this method. This is called the ventriculogram. Near the end of the catheterization, you may be turned on your side by the rotating catheterization table. You may be asked to take deep breaths or to cough. This helps to circulate the dye through your system. As the dye begins to leave your body, you may feel the urge to urinate. This feeling is normal since the dye leaves your body through your kidneys. Tell the nurse so that you may be accommodated. Once your cardiologist has taken all of the X-rays required, the catheter will be removed. If an incision was made, a few stitches will be used to close the skin. The area will be bandaged. The procedure itself usually takes 1 to 4 hours, depending on how involved the procedure is. Upon returning to your room, you will be permitted to eat. Your doctor may recommend bed rest. During this time, if you have to go to the bathroom, please call your nurse. Your vital signs, such as breathing rate, pulse, temperature, and blood pressure, will be closely monitored. Your incision will be checked for bleeding. You may experience some minor discomfort after your cardiac catheterization, such as a bruise where the catheter entered, mild pressure or discomfort in that area, lightheadedness, or mild indigestion. These minor problems may be expected, and you should not be alarmed. There are other problems which may be more serious and should be reported to your nurse immediately. These include bleeding where the catheter entered, severe pain or discomfort in this area, fainting when sitting up, and severe nausea or vomiting. As prescribed by your doctor, you may go home and resume some activities, usually the day after the catheterization procedure. It is your right to be informed of the risks and complications in deciding whether or not to undergo the recommended cardiac catheterization procedure. There is a 1 in 1,000 chance of heart attack, stroke, or allergic reaction to the dye. There is also a 1 in 1,000 chance of death. If the catheter is inserted in your groin area, there is a 1 in 500 chance of bleeding. There is a 1 in 250 chance of significant blood pressure drop. There's also a 1 in 100 chance that the pulse in your leg or arm may be interrupted briefly. The cardiac catheterization procedure gives your cardiologist a clear understanding of the condition of your coronary arteries. The alternative to this procedure is to allow your cardiologist to treat you either medically or surgically without knowing the nature and extent of your heart problem. The cardiac catheterization is highly effective in determining the state of coronary arteries. If no coronary artery disease is detected by this procedure, another cause for your chest pain will be investigated. Treatment by medicine is possible in the presence of mild coronary artery disease. Your cardiologist will discuss the results of your cardiac catheterization with you and your family. At that time, he will recommend the different treatment alternatives best suited for you. It will then be your decision which of these options to choose. Remember, Cardiac catheterization is not an operation. It is a diagnostic procedure that enables your cardiologist to determine which coronary arteries are narrowed, which parts of them might be narrowed, and to what extent they may be narrowed. Please review the accompanying guide and then answer the patient quiz. Be sure to consult your physician with any questions you may have. Being informed enables you to make the best decision concerning your health care.